Parenting information for parents of infants who were substance exposed before birth and are now 0 to 2 months old. Hi Elizabeth. So glad you came in today. When is your due date? Are you having a boy or a girl?
I am having a boy. And I have about a month to go. I thought I would take you up on your offer to sit down with me and talk about the baby and to learn about some things I should be looking out for after he is born. I am really glad I am in recovery now and getting treatment, but I'm still worried that my baby may have problems.
It is normal to feel anxious about how that might affect your baby. Try to remember, you have done the best thing for you and your baby by seeking sobriety. My goal for today is to help you understand infant development from birth to 3 months of age. At times, substance-exposed infants show subtle signs of meeting their milestones a little late. For this reason, I want to share with you what to expect over the next 2 months. Having routine developmental follow-up is important to ensure your baby continues to meet these milestones.
We'll just do the first 2 months after birth for now, because it is a lot of information.
Did you know, the baby is starting to develop and learn even before he is born? And your baby can see lights and recognize sounds right now? That's why we tell moms and dads to talk or sing to the baby before he is born.
No way. So, that means he will be able to recognize my voice at delivery.
Exactly. What better way to introduce him to the world and make him feel safe? So sing and chat away. So now let's talk about what to expect in the first 2 months. Come sit with me and I will show you some toys that are good for infants from 0 to 2 months old. We have these kinds of toys in the baby closet. And you can go shopping with the points you earn in the app.
This one is cute. And it could hang on the stroller. But why is it black and white?
When babies are first born, their eyesight is fuzzy. Within about a week, they are able to see about 8 to 12 inches in front of their face, but can only hold a short gaze. During the first 3 months of age, starting shortly after birth, a baby can only see black and white. Color vision does not begin until around 4 months. So black and white toys are great to start with. You can show the toys while laying down with him, or when changing his diaper. By 2 months, he should be able to follow the toys with his eyes. By the end of 2 months, you will see, he is following you with his eyes when you move around the room. And best of all, he will start to really smile at you at about 2 months of age. That is the best feeling. You can set him up on his back with an activity gym on the floor, but remember to also lay him on his tummy for some of the day too. When he is on his tummy, be sure to stay with him, as he cannot regulate his breathing well at this age. If he falls asleep, he should be on his back. He should be able to hold his head up and begin to push up while laying on his tummy by 2 months. So the key takeaway is that talking, singing, and playing with him will help to create a close bond with him at an early stage and help with his development. Question number 1. Why do you give newborn babies black and white toys? A. Babies prefer stripes to any other pattern. B. Babies don't see very well right after birth, so high contrast toys capture their attention best.
C. Babies can't see colors right after birth.
At 2 months, is just about when he will start wanting to put things in his mouth, so be sure all toys are clean, and don't give him anything smaller than the size of a toilet roll tube. C. This one is great. No way he can choke on it. At 2 months he will like high-pitched voices, and he will start to coo, gurgle, and turn his head towards sounds. Remember, a little baby talk is fine, but try to use real sentences and normal voices too, so he can start to learn your language.
Question number 2. When can babies learn to recognize your voice? A. When you start reading to them at 3 to 4 months before birth, so sing and talk to them before the baby is born. C. Not until they are about 7, 8 months old and can sit up on their own.
So as the baby grows older, his behavior will change too. Sometimes he will get fussy if he gets bored. But the good news is his arm and leg movements will look smoother, and he can now bring his hand to his mouth and suck on his fist, which will help him to be soothed.
That will be good news when he can calm himself down. This has been really helpful, but also a lot to remember. Do you have a handout or something that I can look at on my phone, and what to expect at each month?
We sure do. You can find a checklist for 2-month-olds in the knowledge base section of this app. There will also be a link in the app to handouts. For this module, you will want the handout called the CDC Milestone Tracker to create a checklist on your baby's behavior to show the doctor if you have any concerns. Be sure to keep your developmental follow-up appointments. What is most important is for you to feel secure that your baby is developing in a healthy and normal manner. Thanks for coming in. Next time we meet, please bring your baby, and we'll go over some milestones for older babies.
Thanks so much. See you after the baby is born.
Congratulations! You have successfully completed this module and have earned points.